newest compliance podcast. I'm really excited about this episode because we are joined by Dr. Emily Waters. She is a surgeon at a hospital in Baltimore, Maryland, and I'm going to let her introduce herself. But we are going to talk about ransomware. We are going to talk about the effects of ransomware on a hospital and on the business of a hospital and on patients. And we're going to talk a little bit about AI. So stay tuned for the end about how that gets weaved in. So before we kick it off, Dr. Waters, welcome. Thanks for joining.
Oh, thanks for having me.
So tell us a little bit about yourself. What area do you practice in, and what's it like to practice at a hospital in Baltimore, Maryland?
Yeah, so I do bariatric and general surgery. I do mostly robotic surgery. I'm the chair of our robotics committee here. And really bariatrics, hernias, gallbladders, I do it all. I love doing surgery. It's a passion of mine. I think you have to be passionate about it to do it, but I love doing surgery.
That's fantastic. We're going to talk about robotics in a little bit. Are you aware of some of the ransomware attacks that have happened at hospitals in Baltimore in the past, year or two?
Yes, I have some colleagues / friends at those hospitals that have undergone in hospitals where there have been cyber attacks.
So from the inside, what's that like? Because from the outside, we tend to see a news release about there being a ransomware attack, and there's usually a very generic statement about how that disrupted operations at a hospital. But can you give us a little color for what happens when a ransomware or cybersecurity attack hits a hospital?
It's devastating. It completely shuts down operations, especially for doctors. Everything is electronic these days. So we type our notes electronically, we communicate with other doctors electronically, even communicating with our patients through the MyChart that most places have these days. And all that comes to a halt. For the surgery part, that also stops because the patient's pre-op or their history and physical to make sure that they're safe to undergo surgery and undergo anesthesia, that's all in the system as well. So the surgeries get shut down for a couple of days until things get back online. And then it can be weeks or months of writing handwritten notes or typing up notes that will later have to be resubmitted into the electronic health record. So it just really adds so much time and complexity to patient care.
Wow. So let me unpack this a little bit, and I'm going to push you. Can the hospital that you're at, and a hospital in Baltimore, Maryland, who has withstood some of these attacks, can they operate without access to the internet or the kind of apps that you use to run a business? Can you go back to like paper and pencil, and can the machines operate without access to it? Is it possible to run the business without access to the internet?
Without access to the internet, no. I would say it would be very hard. Without access to your EMR, the electronic medical record, it's possible, but it's way more time consuming, less efficient, and probably less good patient care, but it's not impossible. So that's what usually happens when a hospital undergoes a cyber attack. We revert back to pen and paper, writing orders, which I've never really done before, to be honest. In my training, it's always been electronic. I don't even know how to find a prescription pad to write a prescription for patients these days. It's literally everything is electronic.
That's amazing. So when an attack happens, the effect, I believe, at least one of the Baltimore hospitals was to shut everything down. Mm-hmm. What happens if I was scheduled for surgery that day?
You'd be canceled. Yep. And reschedule, however far out that surgeon's schedule is and whenever the OR can accommodate. If you were an emergency surgery patient, like you were coming through the ER and had appendicitis, I'm not sure if they would transfer you or if they would still get that case on. But in the operating room itself, because we were talking all about the pre-op stuff, but in the operating room itself, everything's electronic in terms of recording stuff. Like the nurse in that room is recording what instruments are being used, what time the surgery started, anesthesia for giving your anesthesia. That is all on an electronic monitor, watching your heart rate, the medications. It automatically transfers your heart rate throughout the whole surgery into the computer system. So that's recorded. That's part of your record, how you underwent anesthesia, all that. So it depends on the hospital and what backup systems they have in place to take care of the emergency patients, because patients still have to get taken care of.
Now, you talked a little bit about the pre-op, and when you and I talked a little bit before we decided to do this podcast together, I was really surprised. I shouldn't have been, but surprised to learn that one of the big considerations going into any surgery is understanding a patient's history. And when a system is down, you don't have access to the history. So can you talk a little bit about that?
Right. Yeah. So all my patients, every patient undergoing surgery has to be seen by a doctor, like the primary care doctor, to check their heart, their lungs. For patients who are higher risk, especially the morbidly obese I take care of through bariatric surgery, they usually have to have an echo, which is an ultrasound of their heart. And since everything is electronic, that's in the chart. You just click on that patient's name. And even if it's in Maryland, we have a very good interconnected system. So if that was done at Johns Hopkins, we can still pull it up here at our hospital. So if you don't have that information and this patient is coming for surgery and they have high blood pressure, diabetes, the anesthesiologist is going to be like, where's that ultrasound of the heart? I need it. And we don't print out those records anymore. It's all electronic. So we wouldn't have the information.
So you really couldn't proceed with care because you're going in blind. You could do a lot of damage.
Yes.
Wow. So a cyber attack can bring a hospital to a halt.
Yes.
And you said can take weeks or months to get back up and running. Like, what does that look like?
I've been fortunate not to be at a hospital where there's a cyber attack, but from my colleagues that have undergone it, it's, like I said, handwriting notes or writing in a Word document, but that all has to be later uploaded into the patient's chart. So it's all printed out. And right now I see a patient, I electronically send my note to their primary care doctor, but now that would had to be faxed or snail mail to their doctor so they know what we talked about. So it just totally changes how you do your workflow. And if a patient comes in to my office for big hernia, I usually want to see their CAT scan. If they had a CAT scan at a different place, I can pull it up. But now I'm asking the patient, do you have a CD copy of that CAT scan? And how many patients do you think have CD copies of their CAT scan? That you just don't get those anymore. So then it's delaying their care because I have to request it. So it totally slows everything down to snail pace.
Right. And it has ripple effects because if you're sending them to other hospitals in the area, now you're sort of burdening a schedule that was already packed at other area hospitals.
Right.
And so it just ripples out from there. So I'm going to switch gears for a little bit. You mentioned that you're the chair of robotics at your hospital. What does that mean?
So as a chair, I got to usher in getting a brand new robot at our hospital. I get to help encourage other surgeons to use the robotic technology we have and make sure, since it is a limited resource at our hospital, that we are optimizing it and that the surgeons who want to use it are able to use it and have access. The whole future of surgeries shifted towards robotics, and it will only continue to shift more towards robotics. So just making sure that we are up to date and taking advantage of this technology.
Does this mean that you are not cutting with your hands, but you are cutting through a robot's hands?
Yes and no. So I always tell patients, like, the robot is not doing the surgery. It's just a tool. It's like, using a push mower versus using a riding lawnmower. There's still someone in charge of it. It's just a different tool. So I still make the incisions to start the surgery, place the instruments, and then I am controlling it with my hands, but not directly.
Okay. Does this robot record the surgery?
So it can. You can record your surgeries on it. And really any laparoscopic or any type of surgery that uses a camera, you can record it.
So, the tech industry has been swept up in AI and what AI can do in the future, both good and, a little concerning. Have you ever thought about the robot getting so smart on your surgeries and other people's surgeries? And I don't know who owns that data of recording a surgery, that one day the robot could replace a surgeon?
I mean, that is ultimately a fear, right, that I will be out of a job much sooner than I anticipated. I think that could be a possibility in the future. I'm hoping not in my lifetime, but they do take in all the information. How many times you use this instrument, how many times you even switch out the instruments, how many you have to click a button when you're moving your hands, so they can even take into account how many times you're clicking. It will gain enough information where that may be possible. There's still so many variety in human anatomy that I don't know that we will ever be able 100% to use a robot to operate. There's just too much variety or too much split second decisions that can take place that you need a human to manage. But I think it is something will happen with that data. I'm not quite sure where it's going to go though.
You know, drawing a conclusion from the earlier part of our conversation that a hospital could literally be put out of business for a few days, a few weeks, or a few months if you're not able to access your electronic records. You know, if there's a cyber attack on a robot, no surgeries are happening. And if you haven't brought up surgeons to understand how to do surgery, you've got to wait until that robot can be trusted again. So I personally think that we have to do both. We have to continue training our workforce. We have to continue training humans. There are snap judgments that need to be made. And the robot is only as good as everything that it's learned. But I mean, to say that one day an engineer would be out of a job because AI can code for them, which is something we talk about a lot in my world, or that a surgeon could be out of a job because a robot can do surgery for them, means that at a certain point, engineers and surgeons have stopped learning. I can't imagine that that's the case.
No, I hope not. And I think you hit on something that is actually a debate in the surgery world, in the surgery training, how we train surgeons, because there's such a focus on robotics, and actually robotics is easier to learn, I'm going to be honest, than laparoscopic surgery. And there's a debate, like if we're not teaching these surgeons how to do laparoscopy or open surgery, and they're only reliant on a robot, their skill set isn't complete. So you actually bring up an exact point of contention within surgical education.
Wow. Yeah, it's happening all over the place. So when you think of these cybersecurity attacks in the news, when you hear what happened with United Health and when you hear what happened with some of the hospitals, like, what do you, as Dr. Waters, or maybe who you are in your personal life, like, what do you think? How does that affect you? How do you think about how to protect yourself and your own sort of digital life?
Yeah, it's really scary. I think I used to not pay attention too much to like freezing your credit or stuff like that. But when you hear about friends, or even I have another surgeon friend who had her identity stolen, and you just become more aware that the attacks are not so physical these days. They're all through cyber. And as someone who is not very technologically savvy, other than knowing how to use a robot, it's very intimidating to realize that you're vulnerable.
This might be the best line of the entire podcast because I am not technically savvy enough to use a robot.
Yeah, but all the other tech stuff, I'm very
Yeah.
narrow-minded with the tech. So
What do you do for fun?
I like to read, work out, travel. I just got scuba certified last year, so I've been scuba diving a bunch. Those are kind of my stress relievers.
Where would you say has been the coolest place that you've done scuba diving?
Ooh. There's two. One is the Azores in Portugal, because I got to see an octopus, which is really hard to see an octopus in real life. And then the second would be Portugal, because I got to see a hammerhead shark, and that was just fantastic. So those would be my top two. But like I said, I've only had my certification for a year, so I have many more places to explore.
That's fantastic. Well, I can't thank you enough for taking time out of your busy schedule and caring for patients to come talk to us a little bit about your experience with ransomware and cybersecurity attacks and robotics and AI. And very, very grateful. Thank you for sharing your perspective. And we'll keep doing all the good work to try to keep our hospitals and our healthcare system safe.